Did you know that chronic obstructive pulmonary disease is now the third leading cause of death worldwide, silently crippling millions before they even realize they're sick? What if I told you that by the time most patients feel short of breath, nearly half of their lung function may already be lost? This is the silent danger of COPD, a disease far more common and far more deadly than most people believe. Before we begin, this video is for educational and informational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult your physician or qualified health provider regarding any medical condition or health concerns. Chronic Obstructive Pulmonary Disease, COPD. Chronic obstructive pulmonary disease remains one of the most pressing yet under-recognized public health challenges of our time. According to the World Health Organization, WHO, COPD is the third leading cause of death globally, responsible for approximately 3.23 million deaths in 2019 alone. Alarmingly, the majority of these deaths occur in low- and middle-income countries, where early detection and access to treatment remain limited. Despite its growing burden, COPD often progresses silently. Studies suggest that nearly 50% of individuals with significant airflow limitation remain undiagnosed until the disease reaches a moderate or severe stage. This diagnostic gap delays intervention, allowing irreversible damage to accumulate in the lungs. The Global Initiative for Chronic Obstructive Lung Disease, GOLD, further emphasizes that early intervention with risk factor modification, especially smoking cessation, can significantly slow disease progression and improve quality of life, yet such opportunities are frequently missed. Moreover, the economic toll is staggering. In the United States alone, the annual direct and indirect costs of COPD are estimated to exceed $50 billion, reflecting hospital admissions, lost productivity, and long-term disability. These numbers highlight the importance of public awareness, early screening, and comprehensive management strategies aimed not only at symptom control but also at preventing disease progression and reducing exacerbations. In this video, we will delve deeper into the causes, pathophysiology, clinical implications, and emerging therapies for COPD, a disease that, despite its widespread impact, continues to lurk in the shadows of public consciousness. Signs of COPD. Have you ever wondered why some people dismiss persistent coughing as just a smoker's cough, only to discover years later that this was the earliest warning sign of irreversible lung damage? Consider the story of Mr. Dennis Menser, a 58-year-old former construction worker, who thought his morning cough and occasional shortness of breath were simply the price of decades of smoking and dust exposure. Like many, he believed these symptoms were normal for his age and lifestyle, until he found himself gasping after climbing a single flight of stairs. By then, nearly half of his lung function was gone. This is the hidden danger of COPD. Its signs often masquerade as benign or age-related changes, leading to dangerous delays in diagnosis. The early signs of COPD can be subtle but are crucial for timely recognition. Chronic cough, often dismissed as smoker's cough, is frequently the first symptom. It may be dry or productive of sputum. The excessive sputum production, especially in the morning, indicates chronic bronchial irritation and mucus hypersecretion. Progressive breathlessness, dyspnea, during exertion is a hallmark feature. What starts as mild breathlessness when climbing stairs can gradually progress to difficulty performing daily tasks such as dressing or bathing. Wheezing and chest tightness may also develop, often misattributed to asthma or allergies. Frequent respiratory infections, including bronchitis and pneumonia, are common due to impaired airway clearance mechanisms. In advanced stages, fatigue, unintended weight loss, and even cyanosis, bluish discoloration of lips or fingertips, can occur due to chronic hypoxia. What makes COPD particularly insidious is that many patients adapt their lifestyle unconsciously, walking slower, avoiding exertion, masking the severity of their condition until a crisis, such as an acute exacerbation, forces medical attention. If you or someone you care for has a persistent cough, frequent chest infections, or unexplained breathlessness, especially with a history of smoking or environmental exposure, do not ignore these signs. Seek spirometry testing early. COPD caught in its earliest stages can be managed, slowed, and in some cases, its progression significantly reduced. Remember, early recognition saves lungs. Early action saves lives. Causes of COPD. Have you ever thought about how something as ordinary as the air you breathe, or the habits you keep could slowly and silently destroy your lungs over time? Take the example of Mrs. Sarah Cowan, a 62-year-old non-smoker from a rural village who had never touched a cigarette in her life. Yet she developed severe COPD. The culprit? Decades of cooking over an open fire, inhaling biomass fuel smoke every single day. This reminds us that while smoking remains the leading cause, COPD is not limited to smokers alone. The primary causes of COPD include cigarette smoking, by far the most significant risk factor. Smoking accounts for up to 85 to 90% of COPD cases in developed countries. Each puff introduces thousands of harmful chemicals that inflame and scar the airways, gradually reducing lung elasticity and function. The exposure to biomass fuel smoke. In many parts of the world, especially low-income countries, prolonged exposure to indoor air pollution from burning wood, charcoal, or dung for cooking and heating is a major cause, affecting even non-smokers like Mrs. S. Occupational exposure. Long-term inhalation of industrial dusts, vapors, and chemical fumes, common in construction, mining, and manufacturing, increases COPD risk significantly. Workers exposed to silica dust, asbestos, or coal dust are particularly vulnerable. Air pollution. Chronic exposure to outdoor pollutants, including nitrogen dioxide and fine particulate matter, PM 2.5, can contribute to lung inflammation and exacerbate existing disease, though it's generally a smaller risk compared to smoking. Genetic factors. A rare inherited condition known as alpha-1 antitrypsin deficiency can predispose individuals to early-onset COPD, even in the absence of environmental exposures. Respiratory infections in childhood. Severe or recurrent lower respiratory infections during early life may impair lung development, increasing susceptibility to COPD later. What's striking is that these factors do not act in isolation. A smoker exposed to occupational dusts or a woman cooking over open flames with poor ventilation may face compounded risk. No one is immune to COPD risk, not even non-smokers. Avoiding or reducing exposure to lung irritants is key. Quit smoking, improve indoor ventilation, use cleaner fuels where possible, and follow occupational safety guidelines. Remember, protecting your lungs today prevents suffering tomorrow. Your environment and your choices matter more than you think. Symptoms of COPD. What if the simple act of tying your shoelaces left you breathless? Or a walk to the mailbox felt like climbing a mountain? Meet Mr. Li Sheng, a 60-year-old retired teacher, who noticed that he could no longer play with his grandchildren without feeling exhausted and wheezing. He thought it was just getting older. But this wasn't aging, it was COPD, creeping in with symptoms he had long overlooked. The classic symptoms of COPD are often gradual, and because of this slow onset, many patients mistake them for part of normal aging or poor fitness. Yet these symptoms are clear warning signs of compromised lung health. Chronic cough. Typically the first and most persistent symptom, this cough is usually productive, bringing up mucus, sputum. It's more than an occasional throat clearing, it's daily, often worse in the mornings. Sputum production. Increased mucus production reflects chronic irritation and inflammation of the airways. Some patients report needing to clear their chest every morning. Dyspnea. Shortness of breath initially noticeable only during exertion, like walking uphill or carrying groceries. Breathlessness progresses until it interferes with even light activities or occurs at rest in advanced cases. Wheezing and chest tightness. A whistling or squeaky sound when breathing, especially on exhalation, may occur as the airways narrow and become inflamed. Some patients describe a sense of heaviness or tightness in the chest. Frequent respiratory infections. Repeated bouts of bronchitis or pneumonia may be the first indication that the lungs are struggling to defend against pathogens. Fatigue. The increased work of breathing saps energy, making everyday tasks exhausting. Weight loss and muscle wasting. In severe stages, the effort of breathing burns extra calories, and chronic hypoxia contributes to muscle wasting, especially in the limbs. A cyanosis, bluish lips or fingernails indicates low oxygen levels in the blood, a late but serious sign. Importantly, COPD symptoms can fluctuate. Patients often experience exacerbations or sudden worsening of symptoms that may require hospitalization. These events are dangerous and can accelerate disease progression. Do not ignore a persistent cough, breathlessness, or unexplained fatigue, especially if you have risk factors like smoking or pollutant exposure. Early recognition allows for interventions that can greatly improve quality of life and prevent disability. Remember, breathlessness is not normal aging. If breathing becomes effortful, your lungs may be trying to tell you something. Listen and seek medical advice early. At this point, you may be wondering, could these symptoms be affecting you or someone you know? If you've noticed a lingering cough, unexplained shortness of breath, or increasing fatigue with everyday activities, don't dismiss these warning signs as simply getting older or out of shape. Early detection of COPD can make a profound difference. A simple, non-invasive test called spirometry can assess your lung function and help diagnose the disease, often before serious damage occurs. The earlier COPD is identified, the more effective interventions like smoking cessation, pulmonary rehabilitation, and medication can be in preserving lung function and improving quality of life. Take a moment, reflect on your breathing, your energy levels, your cough. If anything feels off, consult your healthcare provider. Acting early may prevent years of discomfort, hospitalizations, and irreversible lung damage. Remember, COPD may progress quietly, but your response to its early signs doesn't have to be silent. Diagnosis of COPD. What if you were told that by the time you first feel short of breath from COPD, nearly half of your lung capacity could already be gone? This was the case for Mrs. Kent, a 55-year-old office worker who came to the clinic after struggling with breathlessness while climbing stairs. Until then, she had blamed stress and weight gain, but a simple test revealed the true cause: moderate-stage COPD. Diagnosing COPD requires careful evaluation because its early symptoms often mimic other conditions such as asthma, heart failure, or even simple deconditioning from inactivity. To avoid misdiagnosis or late detection, a structured approach is essential. 1. Clinical history and risk assessment. The first step is a thorough discussion of symptoms, chronic cough, sputum production, breathlessness, and risk factors such as smoking history, occupational exposures, or prolonged indoor air pollution. Family history and past respiratory illnesses are also considered. 2. Physical examination. In mild cases, the chest exam may appear normal. However, as COPD progresses, signs such as wheezing, prolonged expiratory phase, reduced breath sounds, and even use of accessory muscles for breathing may be evident. 3. Spirometry, the gold standard test. This simple, non-invasive breathing test measures the volume and speed of air a patient can exhale. A post-bronchodilator FEV1/FVC ratio of less than 0.70 confirms persistent airflow limitation, the hallmark of COPD. The degree of reduction in FEV1, forced expiratory volume in 1 second, helps classify disease severity. For additional tests, O chest X-ray or CT scan, useful to rule out other diseases or visualize signs of emphysema. O arterial blood gases, ABG, to assess oxygen and carbon dioxide levels in advanced disease. O alpha-1 antitrypsin level, especially in younger patients or those with a family history, to rule out genetic deficiency. 5. Assessment tools. Questionnaires like the COPD Assessment Test, CAT, or Modified Medical Research Council, MRC, dyspnea scale provide insight into symptom burden and impact on daily life. A timely diagnosis is critical because lung damage in COPD is largely irreversible, but its progression can be slowed significantly with appropriate intervention. If you or someone you know has persistent respiratory symptoms, especially with risk factors like smoking or pollutant exposure, request a spirometry test from your healthcare provider. It's quick, painless, and could reveal vital information about your lung health. Remember, you can't manage what you don't measure. A simple breathing test today could save years of life and lung function tomorrow. Treatment plan for COPD. What if managing COPD wasn't just about medications? but also about changing the very habits that shape your lungs' future. This is the realization Mr. Randy Oman, a 63-year-old ex-smoker, faced when he was diagnosed with moderate COPD. His first thought was, is there a pill to fix this? But his doctor gently explained, treatment is a lifelong plan, not a quick fix, and the sooner he embraced this, the better his quality of life would become. A comprehensive COPD treatment plan is multifaceted, focusing on symptom control, prevention of disease progression, and improvement of overall well-being. Here are its core components. 1. Smoking cessation, the single most effective intervention. Continuing to smoke accelerates lung destruction. Quitting can significantly slow disease progression, improve symptoms, and reduce mortality. Support through counseling, nicotine replacement therapy, or medications like varenicline or bupropion is critical. 1. Pharmacologic therapy. Bronchodilators, short-acting and long-acting, these relax airway muscles, improving airflow and reducing breathlessness. Examples include beta-2 agonists, e.g., salbutamol, and anticholinergics, e.g., tiotropium. Inhaled corticosteroids, ICS for patients with frequent exacerbations. ICS reduce airway inflammation but must be used judiciously to avoid side effects. Combination inhalers. Many patients benefit from combined bronchodilator and corticosteroid inhalers for better symptom control. Phosphodiesterase 4 inhibitors. In severe cases, drugs like roflumilast reduce exacerbations by controlling inflammation. Mucolytics, antibiotics, and oxygen therapy, used in specific cases, such as chronic sputum production, infections, or resting hypoxemia. 2. Pulmonary rehabilitation. A structured program combining exercise training, education, and nutritional counseling. This improves exercise tolerance, reduces symptoms, and enhances quality of life, often more effectively than medication alone. 3. Vaccinations. Influenza, pneumococcal, and COVID-19 vaccines are vital to reduce the risk of serious respiratory infections that can worsen COPD. 4. Oxygen therapy. For patients with severe chronic hypoxemia, long-term oxygen use can improve survival and relieve symptoms. 5. Surgical interventions. In select cases, e.g., severe emphysema, procedures like lung volume reduction surgery or even lung transplantation may be considered. 6. Management of exacerbations. Prompt recognition and treatment of flare-ups with short-acting bronchodilators, corticosteroids, and antibiotics, if infection is suspected, are essential to prevent hospitalizations and further decline. 7. Lifestyle modification. Nutrition. Maintaining an ideal body weight is important. Obesity and undernutrition both worsen outcomes. Physical activity. Even light daily exercise helps maintain lung and muscle function. Psychosocial support. Anxiety and depression are common and must be addressed. Managing COPD is not about chasing symptoms. It's about a proactive, personalized plan that involves behavior, environment, and medication all working together. No two treatment plans are identical. They should be tailored to your disease stage, lifestyle, and goals. Remember, COPD may be chronic, but disability and decline are not inevitable. The earlier you engage in a complete treatment plan, including quitting smoking, staying active, and following medical advice, the more years of quality life you can reclaim. Implementation of the COPD treatment plan. How does a treatment plan move from paper to real life? This was the challenge faced by Mr. Terry Benson, a 65-year-old man newly diagnosed with COPD. After his doctor outlined the steps, quitting smoking, using inhalers, joining pulmonary rehab, he sighed and said, "It sounds great in theory, but how do I actually do all this in my daily life?" This is the silent struggle many COPD patients face, bridging the gap between knowing what to do and actually doing it. Effective implementation of a COPD treatment plan requires coordination, education, and daily effort, both from the patient and the healthcare team. Here's how it comes to life. 1. Personalized action plans. No two COPD cases are identical. Implementation begins with tailoring the plan to the individual's disease severity, lifestyle, and preferences. Written action plans outline daily medication use, when to adjust therapy, and steps to take during exacerbations, empowering patients to respond early and avoid hospitalizations. 2. Medication adherence. Inhalers must be used correctly and consistently. Poor technique or irregular use drastically reduces benefit. Education on inhaler use, often with hands-on demonstration, and regular follow-up ensures proper delivery of medications to the lungs. 3. Behavioral support for smoking cessation. Quitting smoking is not a single event, but an ongoing process. Practical support includes scheduled counseling, pharmacotherapy, and follow-up calls to prevent relapse. 4. Engagement in pulmonary rehabilitation. Encouraging patients to attend pulmonary rehab classes can dramatically improve endurance and breath control. When formal programs aren't accessible, guided home-based exercise plans can be provided. 5. Regular monitoring and adjustment. Periodic reviews, assessing lung function, symptom control, and side effects, allow timely adjustments in therapy. This prevents overtreatment, undertreatment, or missed opportunities to slow disease progression. 6. Integration of psychosocial care. Addressing depression, anxiety, and social isolation through counseling or support groups enhances treatment success, as mental well-being strongly affects physical health. 7. Family and caregiver involvement. Educating family members ensures they can support inhaler use, emergency action steps, and lifestyle adjustments, making adherence more sustainable. 8. Technology support. Mobile apps, text reminders, and telemedicine consultations can keep patients engaged and on track, especially in remote or underserved areas. A treatment plan is only as good as its real-world execution. COPD care must become part of everyday life, as routine as brushing teeth. This requires planning, education, and support. Remember, consistency, not intensity, transforms COPD care. Small daily steps, taken faithfully, protect lung function and prolong independence far better than occasional heroic efforts. Monitoring and follow-up in COPD management. What happens after the prescription is filled, the inhalers are started, and the patient walks out of the clinic? This was the question that puzzled Mr. Dwayne Larry, a 58-year-old former smoker who thought his diagnosis was handled after getting his first inhaler. But 6 months later, he found himself breathless again, this time in the emergency room, facing a severe COPD exacerbation that could have been prevented with proper follow-up. This story reflects a key truth. COPD management doesn't end with treatment initiation, it begins there. Ongoing monitoring and follow-up are critical to ensure stability, prevent deterioration, and catch complications early. Key components of COPD monitoring and follow-up include: 1. Regular clinical reviews. Patients should be reviewed at least twice a year, or more frequently for severe cases, to assess symptom control, exacerbation history, inhaler technique, medication adherence, and side effects. These visits are an opportunity to adjust therapy as the disease evolves. 2. Spirometry testing. Lung function should be reassessed annually to monitor disease progression. Significant declines in FEV1 may signal worsening disease, prompting treatment reevaluation. 3. Exacerbation surveillance. Monitoring for increased frequency or severity of exacerbations, flare-ups, is vital. Early detection allows prompt intervention with short-acting bronchodilators, corticosteroids, or antibiotics, reducing hospitalization risk. 4. Vaccination updates. Ensuring up-to-date influenza, pneumococcal, and COVID-19 vaccinations at follow-ups is a simple but essential preventive measure. 5. Assessment of comorbidities. Conditions like cardiovascular disease, osteoporosis, depression, and lung cancer often coexist with COPD and influence its course. Regular screening and management of these comorbidities improve overall outcomes. 6. Nutritional and psychosocial evaluation. Weight loss, frailty, anxiety, or depression can subtly worsen COPD prognosis. Routine checks allow early nutritional support and mental health referrals. 7. Patient education reinforcement. Every visit should reinforce correct inhaler use, smoking cessation, physical activity encouragement, and self-management plans. Education is an ongoing process. 8. Pulmonary rehabilitation reassessment. Assess if patients remain suitable for pulmonary rehabilitation or if re-enrollment would benefit those with functional decline. 9. Telemedicine and remote monitoring. Especially useful for rural or immobile patients, virtual follow-ups ensure continuity of care without the barrier of travel. In COPD care, set it and forget it doesn't work. Continuous monitoring is essential to adapt the treatment plan, prevent complications, and maintain quality of life. Even stable patients can silently deteriorate without regular reassessment. Remember, follow-up is the safety net that catches the silent worsening of COPD. Stay connected with your healthcare provider, because breathing well tomorrow depends on the care you receive today. Prevention of COPD. What if you could stop COPD before it ever robbed you of your breath? This was the question that 30-year-old Ms. A asked when she learned that her father, a longtime smoker, was struggling with advanced COPD. She wondered, could she protect herself from the same fate? The answer is clear: COPD is largely preventable, and taking action early can save decades of healthy lung function. Here are the critical steps in preventing COPD. 1. Smoking avoidance and cessation, the cornerstone of prevention. The single most important cause of COPD is tobacco smoke. Never starting is ideal, but for those who do smoke, quitting at any stage drastically reduces the risk of developing COPD. Even after years of smoking, stopping slows lung function decline and reduces the chance of respiratory disease. 2. Occupational and environmental exposure control. Chronic exposure to dust, chemical fumes, vapors, and indoor pollutants, such as biomass fuel smoke, significantly raises COPD risk, especially in low-income countries. Adequate workplace ventilation, protective equipment, and cleaner household cooking and heating methods are essential safeguards. 3. Air quality improvement. Reducing outdoor air pollution through community-level interventions and personal precautions, like staying indoors on high-pollution days, protects vulnerable lungs from irritants that promote airway inflammation. 4. Early detection of at-risk individuals. Screening high-risk populations such as smokers over 40 or workers in polluted environments with spirometry can detect early airflow limitation before symptoms appear. This allows for early lifestyle changes that prevent progression. 5. Childhood respiratory health promotion. Preventing and treating childhood respiratory infections, avoiding passive smoke exposure, and encouraging vaccination reduce the risk of impaired lung development, a key factor in future COPD risk. 6. Vaccination. Routine immunizations against influenza, pneumococcus, and COVID-19 reduce the burden of respiratory infections that can damage the lungs and contribute to COPD development later in life. 7. Public awareness and education. Community programs that inform people about COPD risk factors, symptoms, and prevention strategies can drive behavior change at the population level. COPD is not an inevitable disease of aging, it is preventable. The lungs are remarkably resilient when protected from harmful exposures, especially tobacco smoke and pollutants. Remember, prevention starts long before the first cough or breathlessness. Whether by choosing not to smoke, improving air quality, or advocating for cleaner environments, you have the power to safeguard your lungs and your future today. Emerging trend insights and management. What if the future of COPD care didn't just slow the disease, but could actually reshape lung health, offering new hope to millions? This possibility is closer than ever, as research and innovation continue to redefine how COPD is understood, treated, and even prevented. Here are the most exciting emerging trends shaping the landscape of COPD care today. 1. Biologic therapies, a new frontier. Traditionally, COPD treatment has relied on bronchodilators and corticosteroids. But new research is exploring biologic medications, drugs designed to target specific inflammatory pathways involved in COPD. For example, monoclonal antibodies like benralizumab and mepolizumab, already used in severe asthma, are being trialed in COPD patients with eosinophilic inflammation, potentially opening the door to personalized, precision treatments. 2. Digital health and remote monitoring. Imagine a patient whose smartphone app detects changes in breathing patterns days before an exacerbation occurs, and alerts their doctor in time to prevent hospitalization. This is no longer science fiction. Wearable devices, smart inhalers, and telehealth platforms are becoming powerful tools in COPD monitoring, enabling real-time data collection, medication reminders, and early intervention. 3. Regenerative medicine and stem cell therapy. Researchers are exploring stem cell-based treatments aimed at repairing damaged lung tissue. Early-stage trials suggest potential for regenerating airway lining and restoring some lung function, an approach that could eventually shift COPD from a managed to a reversed disease in the future. 4. Lung volume reduction with endobronchial valves. For patients with severe emphysema, the use of tiny valves placed inside the airways via bronchoscopy has shown promise. These endobronchial valves allow damaged areas of the lung to collapse, improving the function of healthier regions, a minimally invasive option compared to surgery. 5. Artificial intelligence, AI, in diagnosis. AI-driven algorithms can now analyze chest CT scans and spirometry results to detect subtle patterns of lung damage invisible to the human eye, leading to earlier and more accurate COPD diagnosis, especially in at-risk but asymptomatic individuals. 6. Environmental policy and public health initiatives. On a larger scale, global clean air campaigns and smoking reduction policies are reshaping COPD risk worldwide. For example, India's transition from biomass cooking fuels to cleaner LPG stoves in rural areas is projected to lower future COPD rates dramatically. The digital lifeline. Consider Mr. Stevens, a 67-year-old COPD patient living in a remote village. With limited access to healthcare, his frequent exacerbations once meant emergency hospital trips miles away. But since receiving a wearable oxygen monitor linked to his doctor's clinic via a smartphone app, early signs of respiratory distress are flagged instantly. His inhaler regimen was adjusted in real time after an alert, preventing what could have been a life-threatening episode. Technology, in this case, became a silent but life-saving partner. The future of COPD care is not static. It's dynamic, digital, and driven by discovery. From biologic drugs to AI diagnosis and stem cell research, what was once thought irreversible may one day become reparable. Remember, stay informed, stay engaged. As science advances, so do the possibilities for better breathing, longer life, and greater freedom from the burden of COPD. COPD is not just a disease of the lungs, it's a disease that touches every part of life. How you move, how you rest, how you hope for the future. But with the right knowledge, early action, and a personalized care plan, you can take control before COPD takes control of you. If you or someone you know experiences persistent cough, breathlessness, or unexplained fatigue, don't wait. Seek medical evaluation early. If you smoke, let today be the day you decide to quit. And if you're living with COPD, remember, management is a journey, not a sentence, and you don't have to walk it alone. Stay informed, stay proactive, and stay connected with your healthcare team to ensure that your treatment evolves with your needs. Your breath is life. Protect it, preserve it, and act now, because every small decision today shapes the quality of your tomorrow. If you found this information valuable and want to stay updated on the latest insights, treatments, and breakthroughs in respiratory health and chronic disease care, make sure to subscribe to our channel. Don't forget to like this video if it helped you, and share it with friends or family who may benefit from understanding COPD better. Have questions or personal experiences with COPD you'd like to share? Leave a comment. We'd love to hear from you and discuss more in future videos. Stay informed, stay empowered, and join us on this journey to better health.